I think I'm muted.
Okay, okay. Thank you, Christina. Okay, so this is our project. We're actually looking at an artificial intelligence model to diagnose skin cancers. So as we all know, the incidence of skin cancer is increasing across the world. And the pictures above show the skin cancer. So you have the melanoma, which is the first one. And then the middle one is the basal cell. And then the lateral one is the squamous cell. So up to 75% of skin cancer deaths are from melanoma. So melanoma is the scary one that we want to pick up early and treat. So early detection and accurate diagnosis will allow for prompt treatment of cancers. And the next slide, please. Okay, so how do we evaluate skin cancer? So firstly, we can look at it visually with our eyes, but sometimes there's a lot of limitations to that. So over the years, dermatology has developed imaging. So the microscope has what you've seen here. These are the two examples that we have. They allow us to evaluate the skin a little bit better than just using the eyes. So this is the current standard of care. And if you look at the pictures that we have provided, this is how it would look like on a dermatoscope. And we have 5 things that we evaluate: A, B, C, D, E, E being elevation. So asymmetry meaning that you draw a line across the middle and then you have a look to see whether is it symmetrical or not. Borders meaning if the borders are clear cut. Color, if you have more than 2 colors, then that's bad signs. The microscopic features including vessels, whether there's a white gray veil. So there is a calculation. You can score that, calculate, and then you get a number, and that will show you whether this lesion is high or low risk. So normally for the dermatologist, you have to be very experienced in order to do this quickly, and you have to do it very often. So a lot of the junior dermatologists, of course, lack experience. Uh, we all have a dermatoscope, but not all of us know how to read the images accurately. And of course, our friends in the family care, first line, even friends in the hospital, if they want to read, this is almost difficult because they're not trained in skin. To the next slide. So what we want to do is we want to actually have a way where we can analyze the dermatoscopic pictures rapidly so that it can be diagnosed early if it's a skin cancer. And how do we, once we have this algorithm out, how do we push it to mass media? So we want to have a handphone dermatoscope. So what you've seen earlier on is actually physical dermatoscope. So what we want to do in the second part of our project is actually to make a attachable dermatoscope onto a handphone so that you can easily just take a picture with the handphone, use the app to access our AI algorithm, and then within seconds you should know whether this lesion, whether you're dealing with the cancer or non-cancer, and that could lead to early pickup rate. Currently on the market, there are handphone dermatoscopes available, but very limited and very fixed to only certain models. And of course, the imaging may not be great. So we're actually looking at coming up with a versatile handphone dermatoscope that can attach to all handphones and of course with good imaging capabilities. Okay, the next slide please. Okay, so our first problem is of course to analyze the dermatoscopic pictures rapidly. So as I've mentioned, it takes a lot of training and experience for the dermatologists to be able to read the dermatoscope images rapidly. And even ourselves, we don't actually do the calculation offhand because it's a difficult calculation. You've got to actually write it down and calculate. So most people just have a feel of whether it is or not. And the more experienced you are, the better you get at it. So what we want to do is we want an AI algorithm where it will automatically read the images for you and then tell you whether it is high risk or low risk. So our solution would be to use a deep-based learning technology to have an automatic algorithm, and it will help with the diagnosis. And the second slide. So the next question is quick, easy access via the handphone dermatoscope, like what I've mentioned before. So we're actually working with a company to come up with an adaptable, attachable dermatoscope that is a lot cheaper than the ones that are currently out in the market. It can be used with all smartphones so that eventually everybody can just attach that to their smartphone along with the handphone app that we have, and you can easily diagnose a lesion on your own. Okay, the next slide, please. Okay, so what we are looking at the product is to have an AI algorithm, which we're currently doing with I2R, the handphone app, as well as attachable dermatoscope, which we're doing with Razer currently. And the next one. So with our proposed software, the eventual aim would be, of course, we would extend this to the dermatologists all over. And furthermore, it can be extended to primary care and family physicians as well. So if a patient comes in to see a primary physician for something else and concurrently they have a lesion that they're worried about, the family physician can have a look at it, and based on the app, if it's a worrying lesion, it will allow for early referrals, reduces the anxiety of patients and families, and of course this will allow prompt management, reducing the mortality and morbidity of patients. The next one, please. Okay, so the AI diagnostic algorithm IP is jointly owned, but the future program IP will be jointly owned as well. Yeah. Yeah, that's it.
Thank you, Dr. Lucinda, for the very comprehensive sharing. So we have a few questions regarding the various partnerships that you've had with your commercialization partner. So I remember you mentioned there were, I think, three
Mm,
elements that
yeah,
you're sharing with a commercialization partner. Maybe you could go
yeah.
back to that slide, a few slides up.
I think this is the last slide. The
Uh,
next one and the
yeah,
next one.
this one, correct? Your partner
Yeah,
requirements,
yeah.
correct. So for this one, you mentioned you're collaborating with a few people for
Mm,
which. So for
yes.
this challenge statement, which one are you looking at? I think we could make it clearer for the
So
audience here
this
today.
for this challenge statement, we have handled all these three, and our partner requirement would be someone that can package and market this above product. Product meaning one, two, three as a whole. As
Mm,
in that means we will prepare one, two, and three all ready, and we would like our partner to bring this to market.
understand. And so
Mm.
there wouldn't be a need for any further refinement of the AI algorithm.
No, so all this is currently on the way. So the AI algorithm, we currently have a grant, so we're finishing that up. The handphone application, we have not started that yet, but that's a small, simple project which shouldn't be too difficult. The attachable microscope is ongoing with another company. So 1 and 3 is parallel. We aim to finish it in 1 to 2 years, and then do the application, and the product itself will be ready for marketing. Mm.
Also, there's a question. What other information systems does the solution need to communicate with
Uh,
after?
as in, so preferably, we want to minimize it so that it's easy for users. So technically, this should be what is needed, meaning that the algorithm should be built into the handphone application and attached to the camera system. And then when you take a picture on your smartphone, using the dermatoscope attached to the camera, of course, it should be able to read it out to you already. So there are some other similar models out there, although they don't use deep learning. So the AI algorithm that the models have out there are not as intuitive, or it doesn't learn on its own, or not as defined, and they don't use the standard algorithm, which is the ABCD. And hence we feel like ours with the ABCD as well as the AI deep learning component, this will be more intuitive when it's ready. Mm.
I understand. So I think there was a question more looking longer term at the commercialization angle. So just trying to understand how much does it usually cost for patients to get a dermoscopy test?
Okay, so the dermatoscope itself, I mean, only dermatologists will buy because nobody else uses it. So each dermatoscope, depending on the brand and the function, some have dual light, some can see with light, without light, that kind. So it ranges from about 400-500 to easily about 1,000 plus. And the dermatoscope itself has to be charged with time, and of course it will spoil with time, and then you got to change one every 3-4 years, depending. So that's the dermatoscope, but only dermatologist buys it. So usually if a patient wants to get a mole check, they will come to see us in clinic, and then we will check for them. So it would be a clinical consult. So if you pay consult fees, if you're private with skin center, it's about 120. Of course, if it's subsidized, then it's a slightly cheaper rate. Now, if we have a look at your mole and we feel like it's all safe, then that's it. You come back every year for a checkup. If we have a look at a mole and we say, okay, we don't know whether is this safe or not, there are some features that look worrying, then we would suggest to biopsy the mole, meaning that we will actually do a small surgery to cut out the mole to have a look under the microscope. Now that procedure itself again has private rates. The cutting out procedure, the biopsy, costs about 100 plus, and then the histology, looking under the microscope, is another 100 plus. So looking at about $200-300. And if the result comes back as benign, so this is a safe mole, then that's it. You come back 6 to 1 year later for reviews on a regular check. If it comes back as cancer, then you need to go for another bigger surgery to cut out the margins as well for cancer treatment, and that alone can cost a few hundred to 1,000 depending on the site and the method that we want to use to cut out. So I think the cost depends on whether is it cancer or not to begin with. Now, if you imagine a Caucasian with many moles, and let's say you have a look at all the moles and you think 10 are suspicious, you can't be taking out all 10. Because, I mean, you know, how you going to tell a patient, like, I got to cut out 10 moles, each mole we got to stitch to stitch, you got to end up with a small scar. And if all 10 turns out to be benign, sometimes the patients may be uncomfortable. You know, you got to cut out 10, and this is just at a one review. If every year you see them, and every year you say, you know, you have 5 to 10 more suspicious each time you see them, then the cost will go up depending on how much you want to cut out. Yeah, so I think cost-wise depends a lot on what we're looking at. Whether are we looking at a patient with a lot of moles or not, whether a patient has high risk or not, whether the patient has a lot of suspicious moles or not, whether you're going to cut out all or not, whether, yeah. So I think cost is a bit hard to justify in that sense. I hope that answers the question.
I understand. I think a rough provision of context was really useful. So we have a few questions about how to package and commercialize this solution, and I'm just going to merge some of them together. So from a broader picture, they're asking from a participant of this innovation challenge, how are they going to start working with I2R, NSC, and the dermatoscope for this challenge? So will the algorithm and the dermatoscope be provided for testing, or do they just need to submit a business plan or both? So how is it? What's the range that you're looking at?
We're looking more at a business plan per se, also because the algorithm and the dermatoscope is currently, we're currently working on it with partners already. So it might be difficult for another partner to come in suddenly, I guess. And we have our goals for both 1 and 3. So we are looking more like a business plan. So after we've done this, how do we then move on to sell it to market? Yeah, so more of that rather than helping us with our current work.
I understand. So there were some questions about the general status so that they can build in better into the business plan that you're requesting for. So what is the status of the regulatory requirements for this so far?
Okay, as in how far are we along the way? So for the
what
AI
other regulations that needs to be taken into consideration?
Generally not too much. This is probably not because there's no radiation or radio frequency waves involved. It's really just taking a picture. So it's not even really a medical device per se in that sense. Like if you're looking at regulations, I don't know if that's what they're meaning, whether they have to apply for medical device cert, is it?
Then so I think from you're trying to understand whether there are other regulatory considerations to take into place.
Doesn't really, because this is exactly like a dermatoscope now, and the dermatoscopes are just bought over the counter. I mean, you can easily order one online and get it. So I don't think there's a specific regulation for the dermatoscope per se.
Understand. And the next question, there's also, are there publicly available materials to describe the technologies so that they can better come up with a more realistic business plan? I mean, there were some provided by it, but I think more from the technology perspective.
So basically, I think the main problem is number one, the algorithm. So the AI algorithm, there are a few available on the market, but they're not widely used because they're not easy to use or they're not accurate, and hence it's not a wide uptake by dermatologists around the world. So you can interested participants can have a look at this, but ours is slightly different in the sense that we're trying to package it together with the handphone app with the dermatoscope. So then there isn't any of these available currently has like all three together kind of a model. Again, so that this is like a newer kind of approach. Handphone attachable dermatoscopes, again, there are quite a lot on the market that you can see. But ours would be, as in we're trying to bring the cost down, so it's a lot more affordable. We're looking at a much cheaper dermatoscope so that everybody can buy one. And then it should be attachable to all handphones, and there shouldn't be a limitation in models.
Okay, thank you. So then there's also a question on the commercialization partner because you're looking for a commercialization partner for this. One question was why haven't the NHG looked at collaborating with any of these developers instead of finding for one new commercialization partner? And in that case, so what are you looking for? What elements are you looking for?
As in the ones that we're currently working with?
The new one that you're looking at through this challenge.
As in, why are we not working with our current partners to bring this forward?
Correct.
So the algorithm, we're actually working with I Square R, which is under ISTA, I think. So they don't, I'm not sure if they have a marketing, but I think they're also looking for a marketing person to help us with this. I don't think they actually take it for, as in to sell a product, basically. So they're helping us to come up with the algorithm in that sense. The dermatoscope, I mean, there are companies that does scopes. So again, they may not sell the whole product itself, but they can easily sell the dermatoscope alone. But if you have just the dermatoscope, it's actually like a regular dermatoscope that all of us have. So if you just buy the dermatoscope without the app or the algorithm, then it's like buying a dermatoscope on your own. It doesn't serve the function of this AI early diagnosis melanoma kind of a thing. Yeah, so we haven't had one that combines all three yet, and our current partners don't have that marketing ability. So this is why we're looking for a partner that might be able to help us package and market it to first dermatologists, of course, and then to the primary sector, primary healthcare, if possible. Yeah.
Got it. Thank you. I think we have a few questions that were a little more, and I think on your end you can view it. We have a few questions on the algorithms, but as you mentioned, you're already currently collaborating with iSquare on it. So on things that we're asking for level of accuracy, I think we will not be looking at that because iSquare is developing it. But questions that we would look at are more on trying to understand what this algorithm is doing so they can think of the business plan on it. So for instance, what's the sensitivity or specificity of the current AI diagnostics algorithm?
So of course, like I mentioned earlier when I showed you the dermatoscopic picture, it's A, B, C, D. So basically what we have done, which is I guess a breakthrough, I'm not sure, is to segment the lesion. So I think this is more technical, but apparently it's very difficult to actually segment a lesion. So before you can even do A, B, C, or D, you have to be able to outline the lesion so that the AI actually knows what is it that it's looking at. So we've managed to segment it very nicely, and I think it's more than 95% sensitive for that. But as to whether or not the algorithm, how sensitive and all, we have to develop all four and then combine it before we can tell. So as of now, with the segmentation alone, which is the more challenging part of any AI diagnostic algorithm, that we have done very well. But whether or not, in the end, what is the overall sensitivities and specificities, then we need a bit of time because we haven't really quite come up with it yet. So we have just gotten a grant for this, and the grant started October this year, and it's expected to run a year. So I think we may have more results at the end of the year, or more convincing results. So as of now, we only have the segmentation results, which are great. But as to the other ABCD results, then a bit harder to say now. We don't have data as yet. No. We're still working on it.
Mm. Last but not least, I think we're gonna look at a time. We're probably gonna look at about two more questions. So the question is more from a commercialization angle. Would it be a licensing model to the commercialization company, or how do you envision the commercialization partnership to take place?
I mean, it's not. Uh, we're open to discussion. It doesn't have to be a fixed model, and of course, it also depends on what NHG would be keen to work with. So basically, NFC is part of NHG, right? So I think with that discussion, it will have to be also with them before we can decide. But it's not like we have a fixed idea in mind. I think it's open to discussion. Yeah.
Mm-mm. Okay. And then one question there was, I think to get a better understanding for commercialization is also, will there be sample data sets that could be provided? Maybe even at the shortlisting stage or anything?
So actually currently, the microscopic pictures, we're actually using an online database, which is called the ISIC. It's an international data set. It has more than 10,000 pictures online, both benign and malignant. So you have the benign moles and you have the malignant melanomas, and we're using that data set to teach our algorithm. And of course, NSC has its own data set pictures. So we're going to run that through for the AI to learn because it's deep learning. So the more you feed it, the more it learns. And then after that, then we can run our trials to see how sensitive it becomes. So yes, there are publicly available data sets already. ISIC itself also has ABCDs on the website for people to look at if they're interested to learn more. So they can
Mm,
easily go online. It's a publicly available data set, no issues at all. Mm,
got it. Okay. Thank you so much
thank
for
you.
your time. I think we'll move on to the next few slides. Thank you so much, Dr.
Thank you.
Lucinda and Shiyun, for your time.
Thank you.
If there's any other further questions, we would share it with the innovation coordinator, and this sharing would also be publicized on the healthcarechallenge.sg.
Okay.
Thank you so much.